My name is Michelle Crain, and this is my audience. Breast cancer is one of the most common cancers among women today. I want to start off by telling a story about my grandma. She was my best friend. When I was 18 years old, my grandma was diagnosed with stage 4 invasive breast cancer. I was so scared because I knew how little the doctors could do for breast cancer patients and how little the doctors actually know about breast cancer. By the end of my first semester of freshman year of college, my grandma had completed what we thought was going to be the end of her treatment. She had had a mastectomy, and the doctors had cut out the remaining cancer cells by Christmas break. Later, they found that they hadn't gotten all of the cancer, and she had to continue treatment. 6 months later, she was in complete remission. However, the following year, the cancer had returned and formed a tumor on her lower spine, which left her paralyzed. My grandma passed away about 2 months before my 21st birthday, and which was a month and a half after receiving the second diagnosis. She has been gone for almost 2 years now. Cancer has touched the lives of almost everyone here today in one way or another. Whether it be yourself, your parents, siblings, or friends, someone you know is likely to have cancer at one point in their lives. Now I want to explain to you how cancer generally occurs in the body, and then I will go more in depth about what breast cancer is itself and the different types. Later I will tell you the risk factors and the warning signs. First, I want to tell you what cancer is. Cancer occurs in the human body when the cells divide and grow without normal control instead of dying at a normal rate, meaning there is more death than growth. With breast cancer, the cells in the breast divide and grow more quickly than usual. Tumors in the breast tend to grow more slowly than other tumors. For example, by the time the lump is big enough to feel, it has likely been growing for 10 years. There are two major types of breast cancer, non-invasive and invasive, and it is important to know the differences. Non-invasive breast cancer occurs when abnormal cells grow inside the milk ducts but have not spread to surrounding tissue. Although the abnormal cells have not spread to surrounding areas, it can develop into invasive breast cancer. Invasive breast cancer occurs when abnormal cells inside the milk duct spread to surrounding areas. Cancer cells can spread throughout the bloodstream and the lymphatic system into other areas of the body. There are also other cancers that can occur in the breast that are not specifically breast cancer. Other types of tumors in the breast can be benign, meaning non-cancerous. Now that we know the different types of breast cancer, I want to tell you the major risk factors that are commonly associated with breast cancer. The most important risk factors include factors that are not related to personal choice. Other factors include lifestyle factors, unclear factors, and controversial factors. Gender, aging, genetics, and family and personal history are risk factors that are not related to personal choice. Being a woman is the main risk factor for developing breast cancer. Breast cancer is 100 times more likely in women than in men, likely because men have less estrogen and progesterone hormone levels in their bodies. About 1 in 8 invasive breast cancers are diagnosed in women under the age of 45, and 2 in 3 invasive breast cancers are diagnosed in women older than 55. Studies have shown that 5 to 10% of breast cancer cases are thought to be inherited by a parent. The risk for breast cancer is much higher in women who have blood relatives who have been diagnosed. For example, a woman's risk of becoming diagnosed with breast cancer doubles if her blood relative is her mother, sister, or daughter. The risk is slightly decreased if it is her grandmother or aunt. Women with cancer in one breast have a greater risk of developing it in the other breast or in another location of the same breast. The risk is much higher for women who are diagnosed at a younger age. Lifestyle risk factors include having children, taking birth control, and breastfeeding. Unclear factors include one's diet and vitamin intake, chemicals in the environment, and tobacco smoke and night work. Controversial factors include antiperspirants, bras, induced abortion, and breast implants. Now that we know who may be at risk for breast cancer, let's move on to the common warning signs. Warning signs of breast cancer are not the same for all women. The most common warning signs are a change in look and feel in the breast, a look and feel of the nipple, and nipple discharge. In most cases, the change is not cancer. For example, pain in the breast is more common with non-cancerous conditions than with breast cancer. If any lumps can be felt in the breast and feels the same in the other breast, it is likely to be not cancer. Nipple discharge, although rare, is also a sign of breast cancer. Discharge is the body's natural reaction when the nipple is squeezed. Nipple discharge can become serious when the discharge occurs without squeezing the nipple, only happens in one nipple, or is clear or bloody when it should be milky. I want to conclude by saying that women are not the only ones that can get breast cancer. Men can also be diagnosed. The likelihood of a man becoming diagnosed with breast cancer is 1.3 men out of every 100,000, whereas women, it's 124.3 women out of 100,000. Many of the risk factors and warning signs are the same. And I know there's been a lot of information to take in such a short amount of time, but if any of you have been touched by this disease, the American Cancer Society and the Susan G. Komen Foundation offer great resources, support, and much more information. And this is my audience.